Now, for the next group of arteries, which we'll get to talk about their clinical application, we'll talk about the common interosseous artery. And the common interosseous artery is the one that gives rise to what? The anterior interosseous artery and the posterior interosseous artery. So basically, we're talking about them, we just talk about all of them together like that. So common interosseous artery gives rise to the what? The anterior interosseous artery and also the posterior interosseous artery. Okay, so their clinical importance is, here is just trying to give a summary of the arteries, right? So the common interosseous artery is the one that will now give rise to the anterior interosseous artery and also the posterior interosseous artery. So it's very important in forearm surgery. So if you are doing any of those surgeries of the radius or ulnar, okay, all those compartment release surgeries, okay, and you basically have to preserve those blood supplies because you don't want to compromise them. Also important in flap surgeries. Okay. Also important in any injuries around that elbow joint. Okay. So collateral supply, consider what it connects with what a lot of arteries in this place, and together they form that rich blood supply at the elbow. So collateral supply maintains perfusion of the wrist and the hand, when there's any issue with the radial and the ulnar arteries. So sometimes it may be absent. Okay, and the anterior and the posterior interosseous artery could just arise directly from the source, which is basically the ulnar artery.